Imagine you're a scientist. You spend 8 years developing a heart medication, millions of dollars, thousands of hours, clinical trials, paperwork, everything. The drug doesn't work. Total failure. Your boss is about to cancel the whole project.
Cancel it!
Then, during your final clinical trial in Wales, a nurse walks into the room to check on the male participants. And every single one of them is lying face down on their hospital beds. She's confused. Why is everyone on their stomachs? Then she realizes they're all trying to hide their erections. Congratulations, you just accidentally invented Viagra. This is a true story, and it gets so much better. Pfizer Laboratories. Dr. David Brown and his team are working on a molecule called Sildenafil. The goal? Treat angina. That's chest pain caused by reduced blood flow to the heart. The theory is simple. Sildenafil dilates blood vessels. More blood flow equals less chest pain. Science. They spend 8 years on this. 8 years. Animal trials, human trials, millions in research costs. Finally, they're ready for real patient testing. The location? Merthyr Tydfil, South Wales. Why Wales? Because the coal mines had just closed. Everyone was unemployed, and Pfizer was paying volunteers. Basically, they found a town full of desperate Welsh miners willing to test sketchy heart medication for cash. What could go wrong? So they hand out the pills, tell the miners to take them daily, and wait for the cardiovascular improvements. Spoiler alert, the cardiovascular improvements were minimal. The drug lowered blood pressure by maybe 3 or 4 millimeters of mercury. Not enough to matter. Pfizer's leadership is furious. 8 years and millions of dollars for a drug that barely works. They're about to kill the project entirely. Then they try to collect the remaining pills from the trial participants, and the miners refuse to give them back. Picture this scene. Pfizer sends nurses to collect the unused medication from the Welsh miners. Standard procedure when a trial fails. Get your pills back, move on. But these miners, they're not having it. No, I'm keeping these. Sir, the trial is over. We need the pills back. Absolutely not. The nurses are confused. The drug doesn't even work. Why won't they return it? Then, one particularly observant nurse notices something. Every time she walks into the room to check on participants, they're all lying on their stomachs. All of them, without exception. She reports this to the doctors. The men are acting strange. They won't turn over. They seem embarrassed. The doctors investigate, and that's when they discover the side effect. Sildenafil wasn't dilating blood vessels in the heart. It was dilating blood vessels in the penis. Every single one of those Welsh miners was walking around with an erection that would not quit. Dr. David Brown, the lead researcher, later said, "The whole thing could have been totally missed. I don't think there would be a drug around if that one miner hadn't put his hand up." Actually, he didn't put his hand up, his penis did. But you get the idea. They've spent 8 years developing a heart medication. It failed, but as a side effect, it gives men rock-solid erections for hours. What do? The obvious answer, pivot, rebrand, sell it as an erectile dysfunction drug. But it's 1993. Nobody talks about erectile dysfunction. It's embarrassing, taboo, shameful. Pfizer's conservative upper management loses their minds. We're not selling a dick pill. Are you insane? This will make us a laughingstock. Our reputation will be ruined. This is immoral and disgusting. But Dr. Brown and a few other scientists push back. They realize this could be massive. Erectile dysfunction affects millions of men. There's no good treatment. Penile implants require surgery. Injections are painful and awkward. A pill? Revolutionary. Still, they face opposition from everywhere. The Catholic Church calls it immoral, says it encourages sinful behavior. Legislators lobby against it, don't want to be associated with sex pills. Medical experts insist men will be too embarrassed to ask for it. No demand. Business executives at Pfizer think it'll destroy the company's reputation. But Pfizer eventually decides to take the risk. They rebrand Sildenafil as Viagra, short for Vigor and Niagara, because waterfalls or something. The branding is weird, honestly. They apply for FDA approval. March 27, 1998. The FDA approves Viagra for erectile dysfunction. Pfizer braces for failure. What happens next is pharmaceutical history. Viagra doesn't just succeed, it explodes. First week, 10,000 prescriptions. First month, 250,000 prescriptions. First year, over $1 billion in sales. $1 billion from a failed heart medication. Bob Dole, former presidential candidate, appears in commercials at 78 years old, talking about erectile dysfunction on national television. The taboo is shattered overnight. Men who would never admit they had a problem are suddenly lining up at pharmacies. Yeah, I'll take the Viagra, for science. Urologists, who were previously the least glamorous doctors in medicine, suddenly become rock stars. Pfizer flies them to the breakers in Palm Beach. All expenses paid weekends, dirty martinis, lollipop lamb chops, $2,500 just to show up. One Pfizer sales rep, a guy named Rooney Nelson, becomes the face of the Viagra marketing blitz. His pitch to urologists? This is your chance to be as cool as heart surgeons. And it works. Within 2 years, 35 million men worldwide have used Viagra. The U.S. military alone spends $41.6 million per year on it. $41 million for soldiers. Your tax dollars, hard at work. But of course, all good things come with side effects, and Viagra's side effects are memorable. First, there's the obvious one. If you take too much, your erection lasts for hours. Painful hours. In 2013, a 66-year-old Colombian man named Gentil Ramirez takes way more Viagra than he should. His erection lasts for several days. He refuses to go to the hospital out of embarrassment. By the time he finally seeks help, his penis is fractured and gangrenous. Yes, gangrenous, as in dying and rotting. Doctors have to perform emergency surgery to save it. The lesson? More Viagra is not always better. Then there are the deaths. In the first year alone, Viagra is linked to 552 deaths. Most are heart attacks, because remember, sex is exercise. Your heart rate spikes. Blood pressure doubles. If you're old, out of shape, and on heart medication, bad combo. One particularly tragic case, a man in his 60s takes Viagra to surprise his wife. He's planning this big romantic gesture. They have sex, he has a massive heart attack, dies. When his widow goes through his desk, she finds the bottle. 6 pills prescribed, 5 left. He never got to reveal the surprise. And then there's the counterfeit market. Because Viagra is expensive and requires a prescription, black market versions pop up everywhere. Pfizer investigates and finds fake pills made from boric acid, insecticide, lead paint, talc powder, ground-up sheetrock, and rat poison. Rat poison! People are buying penis pills from shady websites and ingesting literal rat poison. And the worst part? The counterfeits look identical. You can't tell the difference. Here's where the story gets really interesting. Remember how sildenafil was originally supposed to treat heart problems? Well, it turns out it actually does work for that, just not angina. In 2005, 7 years after Viagra launches, the FDA approves sildenafil for pulmonary arterial hypertension. That's a serious heart condition where blood vessels in the lungs constrict. It can be fatal. Sildenafil dilates those blood vessels, improves blood flow, saves lives. They rebrand it as Revatio. Same drug, different name, different dose. And here's the kicker. Revatio goes generic in 2012. Costs less than $1 per pill. Viagra still costs $20 to $50 per pill. Same exact drug. The only difference is the dose and the label. For Revatio, you take a 20 milligram pill 3 times a day for your heart. For Viagra, you take a 50 to 100 milligram pill once for your penis. Technically, you could just take 2 to 5 Revatio pills and get the same effect as Viagra for a fraction of the cost. But Pfizer really doesn't want you to know that. So what's the final tally? Pfizer spent 8 years and millions of dollars on a heart medication that failed. By accident, they discovered it gave men rock-solid erections. They faced massive opposition from religious groups, politicians, doctors, and their own executives. They launched it anyway. It became one of the most successful drugs in pharmaceutical history. 62 million men worldwide have used it. Global sales exceed $1.4 billion annually. And the scientist who discovered it, Dr. Simon Campbell, was knighted by the Queen. That's right, the British government gave him a knighthood. for accidentally inventing boner pills. Sir Simon Campbell, the father of Viagra. Meanwhile, those Welsh miners who refused to return the pills, they're legends, heroes, the unsung champions of erectile dysfunction treatment. If just one of them had been too embarrassed to speak up, Viagra might never have existed. Think about that. The entire global Viagra industry exists because a Welsh coal miner was brave enough to say, "Hey doc, I've got a problem," and also a solution. And they're the same thing. The end.